is that the kind of surgery where they crack open your chest basically to do what is, okay, forget COVID, but we already know in hospitals, high infection risk, he's gonna be opened up. He's a severe diabetic. Healing is an issue. Like, what is the recovery like? What is the chances of a good recovery for Lou?
It's an excellent question. There's no question about the fact that we take poor blood sugar control very seriously, intraoperatively and postoperatively, because of the delayed healing, the risk of infection. At the same time, we use intravenous medications and monitor the blood sugar very closely during and after the surgery. The flip side of this thing is that most of the people that we actually are operating on and doing bypass surgery are diabetics. So there's a tremendous experience in operating on diabetic patients. So to answer your final question, as to what is his outlook in terms of his recuperation, I would say excellent.
Okay.
Yeah.
Is this surgeon that he's being referred to? He got a pretty good track record.
I'm
Do you
sure
know
he would
Sure.
be,
No,
considering
yeah,
who we're
yeah.
talking to here.
Yeah,
The
but-
greatest doctor on the planet would not refer me to
But
anything,
it
but more than the
but
greatest
it could
doctor.
also be because it could also be because insurance only covers certain doctors. You don't know.
Well, that's it. Well, we'll figure that
That's
part
a
out.
good question. That's a good question, I would say, only because just like in any kind of procedure, medical procedure, in bypass surgery also, the experience and the volume of surgeries that a surgeon has done is critical. So Jim Longquist is extremely well trained. He's from Texas Heart Institute, and I've seen his work. He has operated on a lot of our patients, and he has had excellent results for them.
So they,
In fact, he recently operated on one of our very brittle diabetic ladies, and she has done very well.
so they do cut the chest open to get to the heart and do all that, right?
Exactly.
So from the time after they do the surgery, how long would it take before? I mean, how long do I got to be in the hospital before I can get home and start to really recover?
It's 4 days of hospitalization.
Okay.
Sometimes 3, but I would say, let's say 4 days.
Right.
After that, I would say about a week of rehab,
Mm-hmm.
and then I would say about 4 weeks of aches and pains. The post-operative, if you ask any person who has had bypass surgery, their chief complaint is the aches and pains in the chest, not angina, but because of
Pain.
the
Broken
surgery,
bones.
Yeah.
because of the healing process and all that.
Because they're breaking your
Yeah.
bones.
Yeah.
Yeah. Okay. So I mean, I'll go see this other doctor, make an appointment, right? I'm just assuming he can see me like in within a week or so, right? Or
I was
whatever.
actually going to call him just now after we are done speaking, and while you're still here, just to briefly tell him about you,
yeah.
and then I'm going to give him your cell phone number to reach out to you and make a follow-up.
Is this someone that you chose,
See,
or is this
what
the
doctor
insurance?
does that? Come on.
No, not insurance.
You chose
Yeah, it is. I don't even know, what is your insurance?
We have Florida Blue.
Okay, no, yeah. I absolutely not insurance dependent, and totally because he has a very good track record.
That's awesome.
Yeah. Currently, locally, the surgeons that we have, he definitely has best outcomes.
So you're saying, as far as like, I'm gonna have to have, in your opinion, you believe that bypass surgery would be the best recommended way to go
Right.
than anything else. And I highly value your opinion. You absolutely will do whatever you tell me to
Quite honestly, we do a lot of coronary stenting, but there is a place for bypass and a place for stenting.
Yes.
And this is if this was a board question and you were presented in the cardiology boards and they were choice is given in terms of what should be done with this patient, the correct answer would be bypass surgery.
Okay.
Yeah.
And then, of course, they put you out. It's not like local anesthetic, right? It's
No.
they put you. To sleep.
You will go to sleep, and when you will wake up, everything will be done.
All right, cool.
Yeah.
What is the what is the average success rate of people coming out of the surgery?
I think the other.
I'm asking because I personally know somebody who didn't survive the bypass, and so this scares the shit out of me. Sorry for my language, but it does.
There is a mortality rate of about 4% with bypass surgery. So 4 out of 100. But those
Those are good odds.
Those 4 out of, so 96% success rate. But the 4 out of the 100 who have a bad outcome, we can pretty much predict that prior to actually going into surgery. Number one are the people who already have had one bypass and are going to a repeat bypass. And the reason behind the problems we face is all of the adhesions that they have from the previous surgery. So their surgery is much more time consuming and delicate. The second group of people are the people in whom we are fixing the heart, but we are also fixing a valve. We are certainly not fixing a valve, we are just fixing the arteries. The third group is where we are doing a bypass and we are also replacing the aorta in the chest. There's nothing wrong with your aorta, so we are not, because that makes the surgery so much more bigger and complicated.
Yeah.
We are only doing bypass, we are not replacing the aorta. So you will fall definitely in the lower risk category because of that.
Okay. So basically, if I had 100 ping pong balls on the floor, and 4 of them were bad, and the other 100 or whatever was a lottery ticket for $1 million, I will win $1 million. I would absolutely win $1 million. Wouldn't I win $1 million?
You would.
See, so the doctor says so, and and we're not going to hold you up. I know you're very busy, and we got the information that we needed.
I was actually going to call Dr. Lundquist real quick.
I appreciate
give
that
him
so
You'll
much.
have to shut it because Dr. Lundquist isn't going to know.
Yeah,
it's being
okay.
recorded, so you got to shut
Yeah.
that.
Well, there you go. I'm giving you my life in real time. How about that? All right, I told you I'd give it to you. There you go.